Hello, this session will be about the peritoneum, the membrane that lining and covering the abdominal viscera and abdominal wall, and this will be our last session of gastrointestinal anatomy. General features: the peritoneum is a thin serous membrane that line the wall of the abdominal wall and pelvic cavity and cover organs within these cavities. Parietal peritoneum lies the wall of the abdominal and pelvic cavities, and visceral peritoneum cover the organs. Peritoneal cavity is a potential space between the parietal and visceral layer of the peritoneum. It's not true space. Peritoneal cavity is divided into a greater sac and lesser sac. Here, this is the lateral view of the abdomen. You can see the greater sac and in front, and the lesser sac from behind the stomach. You can see the stomach, transverse colon, jejunum, and the third part of duodenum. It is there, pancreas and liver is also appearing the uterus in this view of the female rectum, rectouterine pouch, urinary bladder, and anal canal. And this is the two fold of the greater omentum is also appearing here. The function of the peritoneum is secrete the lubricating serous fluid that continuously moisten the associated organs, absorb and support the viscera. You can see intraperitoneal viscera. This here the relationship between the viscera and peritoneum. We have intraperitoneal viscera, as you can see from this picture, the viscera that completely surrounded by peritoneum, and retroperitoneal viscera. Some organs lies on the posterior abdominal wall and are covered by peritoneum on their anterior surface only. This is the retroperitoneal organs. Extraperitoneal viscera and those has no peritoneal covering. Here, they are found in they cover only by peritoneum from the anterior surface. We have here like upper part of the rectum, we have the upper surface of the urinary bladder, and so on. The structure which are formed by peritoneum, we have the omentum, the two-layer fold of peritoneum that extending from the stomach to the adjacent organs. The lesser omentum, the two-layer fold of peritoneum which is extending from the porta hepatis to the lesser curvature of the stomach and superior part of the duodenum. You can see from this picture, it is very obviously this structure that from the lesser curvature of the stomach to the various surface of the liver and the first part of the duodenum. This is the lesser omentum. Omental foramen or epiploic foramen connect the greater sac and the lesser sac behind the right border of the hepatidinal ligament. Hepatidinal ligament is a ligament that contains portal triad. Superior is found in the caudate lobe of the liver, and inferiorly you have superior part of the duodenum, and anteriorly you will find hepatidinal ligament, posteriorly the peritoneum covering the inferior vena cava. This is the omental foramen or epiploic foramen. The greater omentum. The fold of peritoneum descend from the greater curvature of the stomach and superior part of the duodenum and hang down in front of the columns of the small intestine and then turn up attached to the transverse colon. If an infection occurs in the intestine, plasma cells formed in the lymph node compact the infection and help to prevent from spreading to the peritoneum and other organs. You can see in this picture on the right of the screen, this structure that hanging from the greater curvature of the stomach. This is a greater omentum and have two folds. Here, this is a lesser omentum, and this is a greater omentum from anteriorly. Function of the greater omentum refer to abdominal policeman, prevent the visceral peritoneum from adhering to the parietal peritoneum, facilitate movement of viscera and adhere around the inflamed organs to protect other viscera, cushion the abdominal organ against injury. This is the most two important functions adhered around the inflamed organs. In the case of appendicitis, when the appendix become inflamed before the infection to be spread to the other organ viscera, the greater momentum would come and protect this infection to be from spread to the other organs. And also it's a cushing like ستارة بالنسبة للأحشاء بتاع الأبدومين إنه لو جات صدمات ولا ضربات كده الخفيفة ممكن تغي منها يعني to protect the abdominal organs against injuries. Omental bursa position situated behind the lesser omentum and stomach. This is the omental bursa. Bursa that the space contain fluid. Left is formed by spleen, gastrosplenic ligament and sphenorenal ligament. This is the space. And the right is formed by omental foramen. This is omental bursa. The omental bursa is in the lesser sac. Communicate with the greater sac through omental foramen. Omental bursa is a position behind the lesser sac, behind the lesser omentum and the stomach. That means the space contains small amount of fluid and other organs like spleen, greater gastrosplenic ligament and sphenorenal ligament, and the right forming the omental foramen. And this one here, this is the epiploic foramen. This maneuver is done when we want to block porta hepatis in liver surgery, and we call this maneuver is Pringles maneuver. Pringles maneuver, and we are the hands in the omental foramen or epiploic foramen. Mesenteries or mesocolons, two layers of fold of peritoneum that attach to part of intestine to the posterior abdominal wall. This is called mesentery, like mesentery of small intestine and mesentery of the colon, like that. Ligaments, the two layers of fold of peritoneum that attach to lesser mobile solid viscera to the abdominal wall or viscera is also called ligament, like gastrosplenic ligament, renal ligament, and so on. Fold and of the anterior abdominal wall, we have medial umbilical fold, contain the remnant of urachus or median umbilical ligament. The median umbilical. This view is from posterior. We remove all the back structures, all the viscera, and you are seeing the anterior abdominal wall from behind. You can see here this is the median umbilical fold containing remnant of the urachus, or is called median umbilical ligament. Medial umbilical fold contain remnant of umbilical arteries and in the medial umbilical ligaments. That median, and the first one is median umbilical ligaments, and the second one is medial. The median is in the midline, attached to the apex of the urinary bladder, and the two lateral fold, there's a single median, and the two lateral from the median one is the two umbilical fold containing umbilical arteries, and the first one is contain umbilical ligament. That first one, the remnant of urachus, sorry. The one of the first one, median umbilical ligament, the remnant of urachus attached to the apex of the urinary bladder to the anterior abdominal wall, and the medial by L, that's contain remnant of the umbilical arteries, and they are pairs. And we have lateral umbilical fold contain the inferior epigastric vessels. Then the two lateral folds lateral to the medial umbilical fold. The pouch. In male we have rectovesical pouch, as we talk about, that found between the rectum and urinary bladder. In the female we have rectouterine pouch between the rectum and the uterus. Rectum and uterus. And vesicouterine pouch we have between the urinary bladder and uterus. Nerve supply. The parietal peritoneum is sensitive to the pain and touch pressure, supplied by lower 6 intercostal and varus lumbar nerve. Central part supply phrenic nerve. In the pelvis supplied by obturator nerve. Visceral peritoneum sensitive only to the streets, supplied by autonomic afferent nerve. Ascites is an excess accumulation of fluid in the peritoneal cavity due to the portal hypertension or hepatic cirrhosis, cancer, congestive heart failure, and peritoneal paracentesis treatment. That's all about the peritoneum. I think so it's very clear, and good luck.